Welcome to the deep dive. We sift through the research, the sources, the notes so you don't have to, pulling out the key insights for you. Today we're tackling, well, a pretty formidable challenge for livestock producers everywhere, cattle abortion.
Yeah, and it's more than just an animal health thing. It hits livelihoods, the whole food supply chain. Really, it affects all of us.
Exactly. Reproductive failure in cattle brings these huge economic costs, welfare issues too. And right at the center, we've got two big players, leptospirosis and neosporosis. These are really significant infectious causes.
That's right. And our mission here really is to unpack these diseases. We'll look at how they spread, their impact, which can be kind of surprising on cows, and yes, even on people. And importantly, what can actually be done about them. Think of this as your shortcut, to getting up to speed on something pretty critical.
Okay, so let's start there. When we say cattle abortion, what does that actually translate to for the farmers, the ranchers, and then, yeah, for us?
Well, the technical definition is losing the fetus after about day 42 of gestation. That's sort of when the main organs are there. Before that, it's usually called embryo loss.
Got it.
But either way, it's obviously devastating. And the economic hit. It's immediate. It's serious. You're looking at fewer calves, less milk, vet bills going through the roof, treatment costs, and often, having to cull more animals. The numbers, they really tell the story. It hits the farm's bottom line directly.
Yeah, give us a sense of those numbers, because I think that really drives home why understanding how these diseases work is just so crucial.
Okay, sure. So take leptospirosis.
Okay.
One outbreak, this was in Argentina, cost around 150,000 US dollars, just one outbreak.
Wow.
And if you break it down, like per cow, a single abortion from lepto in a French dairy herd could cost up to 2,369 euros, almost 2,400 euros.
Per animal.
Per animal, yeah. And then Neospro, the projections there are massive. Australia estimates, $85 million a year for their dairy industry, maybe $25 million for beef annually.
Yeah, huge.
Huge. And that's not even counting related things like, say, lameness, which can sometimes go along with these health issues. An average case of lameness is costing over $300 plus extra for every week the cow stays lame. So it just shows how, pervasive and costly these reproductive problems are. And lepto and neo are really major drivers.
Those figures, yeah, they really paint a picture of the financial strain. Makes you think, doesn't it?
Yeah.
What looks like just an animal issue actually sends ripples through the whole economy, right down to, well, potentially consumer prices.
Yeah.
So let's get into the how. How do these two diseases, leptospirosis first, cause this kind of devastation?
Okay, leptospirosis. It's a bacterial threat found pretty much everywhere. The bug itself is Leptospira spp. It's a spirochete, kind of like a tiny corkscrew shape. And there are loads of different types, over 250 serovars. They're slightly different, which makes identifying the specific one important for, vaccines and treatment. In cattle, the main ones are adapted to them, like Elborg, Petersoni, Serovar harjo. But you can also get incidental ones, like Pomona, maybe from pigs or wildlife.
Yeah, how does it spread?
Mostly through contact with contaminated water or urine. Infected animals shed the bacteria in their urine, sometimes for months, because it sets up shop in the kidneys.
Right.
Direct contact works too, even sexual transmission during mating. And these bacteria, they're quite tough. They can survive in damp, warm, alkaline places for up to 6 months.
6 months? Wow.
Yeah. So things like mixing herds or sharing streams or ponds definitely increases the risk.
Okay, so it spreads easily. But how does this specific bacteria actually lead to the reproductive failure, the abortion?
Right. This is a really key insight. The leptospires, the bacteria, they cross the placenta when the mother has them circulating in her blood. They infect the fetus, and that leads to its death.
Okay, that makes sense.
But here's the really interesting part, the sort of aha moment from the research. Unlike a lot of other bacteria, Leptospira doesn't cause a big, obvious inflammatory reaction in the cow's uterus, in the endometrial cells.
Really? No inflammation?
Studies showed pretty much no increase in those pro-inflammatory signals you'd expect. It's this sort of non-inflammatory interaction. And what that means is...
Hey, sneaky.
Exactly. It allows for these chronic, silent, subclinical infections. So it's working kind of stealthily. Farmers might not see the usual warning signs, not until abortions start happening, maybe affecting up to 30% of a newly infected herd.
That makes it incredibly hard to catch early then.
Definitely. The main sign is the reproductive failure, especially later in pregnancy, say the last third. You see stillbirths, premature births, weak calves. And it's insidious because the fetal loss can happen weeks after the mother got infected, and she might look perfectly fine otherwise.
Any other signs? Or is it just the abortion? Well,
Sometimes you see acute signs. There's something called milk drop syndrome. A sudden drop in milk, maybe it looks yellow, thick, even bloody. Fever, jaundice can happen too, but often the reproductive loss is the main or only thing noticed.
so if it's so often silent, this hidden enemy, how on earth do vets even diagnose it? How do you pin it down?
Yeah, it's tricky. It really needs what we call a multimodal approach. You combine different tests. So
Okay.
there's serology, tests like MAT or ELISA. They look for antibodies, basically the immune system's memory of the infection.
Fine, like fingerprints.
Kind of, but, and this is a really critical point, these tests can't tell the difference between antibodies from a real infection and antibodies from a vaccination.
Because the vaccines also make antibodies.
Exactly. And those vaccine antibodies can stick around for years. So it makes figuring out the actual infection status really challenging in vaccinated animals. That's why testing the whole herd often gives a better picture than just one animal.
Okay, so serology is one tool, but with limitations. What else?
There's PCR polymerase chain reaction. That's a molecular test. It looks directly for the bacteria's DNA. You can test fetal tissues, kidney and liver good spots, or the placenta, even urine. It's much faster than trying to grow the bacteria.
Growing it, like in a lab culture.
Yeah, bacterial culture. But Leptospira are really fussy, difficult to grow, and it takes ages. So it's not very practical for everyday diagnosis. PCR is usually preferred.
Okay, so you've managed to diagnose it. What's next? Treatment. Control.
For treatment, antibiotics like oxytetracycline or penicillin can work, particularly if you catch it early. But honestly, prevention is where the focus really needs to be.
Right. Stop it before it starts.
Exactly. Vaccination is key. There are vaccines, usually inactivated whole cell bacterins. You typically give 2 doses to start, then an annual booster, often in the spring. This helps reduce shedding and abortions.
And beyond vaccines.
Biosecurity. It's absolutely fundamental. Things like having a closed herd, not bringing in new animals without testing and quarantine, avoiding shared water sources, getting rid of aborted fetuses and placentas properly so they don't contaminate things, and controlling wildlife. Rats, mice, raccoons, foxes, skunks, opossums, they can all carry and spread lepto.
Wow, quite a list. Okay, that covers the cattle side extensively. But you mentioned humans earlier. Let's connect that bigger picture. Does leptospirosis jump species? Is this a risk for people?
Yes, and this is really important. Leptospirosis is a serious zoonotic disease. That means it does jump to humans. Globally, it's responsible for estimated over 50,000 human deaths every year.
50,000, that's staggering.
It is, and over 1 million infections globally each year. People usually get it from contact with contaminated water or soil, often containing animal urine or direct contact with body fluids from infected animals.
So who's most at risk?
People in certain jobs, definitely.
Yeah.
Vets, farmers, slaughterhouse workers, anyone working closely with animals or their environment.
And what does it look like in humans?
It can range quite a bit. Sometimes it's mild, almost like the flu fever, headache, muscle aches, but it can become very severe, potentially fatal. We're talking kidney damage, liver failure, which causes jaundice, that yellowing meningitis, even severe bleeding in the lungs.
Goodness.
Certain groups are at higher risk for severe disease too, like pregnant women, the elderly, or people with weakened immune systems.
So from a public health angle, what's the advice?
Basic precautions, really. Avoid swimming or wading in water that might be contaminated, especially after floods. Cover any cuts or scrapes if you're working with animals or potentially contaminated soil or water. And if you think you've been exposed and developed symptoms, seek medical help quickly. Early antibiotic treatment is really crucial for humans. It makes a big difference.
And what about things like milk?
Thankfully, pasteurization kills Leptospira. So pasteurized milk and dairy products are considered safe from this particular bug.
Okay, that's a relief. Whew! Leptospirosis is clearly a major concern both for animals and people. Right, let's pivot now. Let's talk neosclerosis. You said it has a similar impact abortion, but it's a totally different organism, right?
Yep.
And maybe even trickier to manage.
Exactly. Neosporosis isn't caused by bacteria. It's a protozoan parasite, Neospora caninum. It's actually closely related to another parasite you might have heard of, Toxoplasma gondii, the one linked to cats.
Ah, okay. So if Toxoplasma has cats, what's the connection for Neospora?
Dogs. Dogs are the key. They are the definitive hosts. That means the parasite has to go through a dog to complete its life cycle and become infectious to others.
How does that work?
Dogs shed the infective stage, called oocysts, in their feces after they eat infected tissue, things like aborted fetuses, placentas, maybe infected wildlife. Wild cannials like coyotes, foxes, wolves, they can play a role too.
So dogs eat infected material, then shed the parasite in their poop.
Yep. And then cattle, who are the intermediate hosts, get infected when they accidentally eat, feed, or drink water that's been contaminated with those oocysts from dog feces.
So the dogs are kind of the factory for the infectious stage, and cattle get it from the environment contaminated by dogs. That sounds like a really crucial difference for trying to control it.
Absolutely. Understanding that dog link is fundamental to breaking the cycle. And then, within the cattle herd, there are two main ways it spreads.
Okay.
The most common and really efficient way is vertical transmission. That's from the infected mother cow to her unborn calf during pregnancy.
Right, straight down the line.
Exactly. An infected cow has a really high chance, like 80 to 90% probability, of passing it to her calf.
Wow, that high.
Yeah. And these calves, they're usually born looking perfectly normal. But here's the kicker. They become lifelong carriers, and they'll likely pass it on to their offspring. This leads to what we often see as sporadic abortions popping up in a herd over generations.
So it just keeps perpetuating itself within the herd silently.
Pretty much. Then you have horizontal transmission. That's when cattle get infected from the environment by ingesting those oocysts from dog or coyote feces we talked about.
Okay.
This route, horizontal spread, is more often linked to what they call abortion storms, where you suddenly see a whole bunch of abortions happening in a herd around the same time, hitting many pregnant animals quickly.
Right, because a contaminated feed batch or water source could expose many animals at once.
Exactly. And how it causes the abortion. The parasite multiplies in the fetus, especially in the brain and heart, causing direct damage. Plus, the mother cow's immune response trying to fight it off and inflammation in the placenta also contribute to losing the pregnancy.
Okay, so it's complex. With these different routes and cows often looking normal even if infected, how do you diagnose this one? Especially if you want to prevent one of those abortion storms.
Yeah, diagnosis has its challenges here too. If you have an aborted fetus, sending tissues to the lab is absolutely key, specifically the fetal brain and heart.
Brain and heart. Why those?
That's where the parasite tends to concentrate and cause telltale damage. So the lab can look for the parasite itself or the damage it causes using histopathology, looking at thin tissue slices under a microscope, or they can use PCR again to detect the parasite's DNA.
Okay, so fetal tissues are number one for confirming the cause of an abortion. What about testing the mother cow?
You can test the dam using serology, blood tests like ELISA or IFAT, looking for antibodies. But similar to lepto in a way, just finding antibodies being seropositive doesn't automatically prove that Neospora caused that specific abortion. It just shows the cow has been exposed at some point.
Right, so it's more for screening the herd, seeing who's been exposed rather than diagnosing a single abortion event.
Exactly. It helps identify carriers in the herd.
Yeah.
And this brings up a really crucial point when it comes to dealing with Neospora treatment.
Okay.
There is no effective treatment for neosporosis. None.
Wow, no treatment at all.
Nope. So control is entirely, 100%, about prevention.
That makes those diagnostic tests even more important then for identifying carriers.
Yeah.
But if an animal tests positive and looks perfectly healthy, but you know it's a carrier and likely to pass it on, what do producers do? I imagine culling is the main option, but that must be a really tough call.
It is an incredibly tough decision, absolutely, especially for a valuable breeding animal that seems fine. But from a herd health perspective, controlling Neospora often relies on making those hard choices.
So what are the main prevention strategies then if treatment isn't an option?
It comes back to breaking those cycles we talked about. Biosecurity is huge, making feed storage areas completely dog-proof, keeping dogs, including farm dogs, away from calving areas and pastures as much as possible.
Right, minimizing that fecal contamination.
Precisely. And proper disposal of potentially infected materials, placentas, aborted fetuses, stillborn calves is critical. You don't want dogs or wild canades scavenging them and getting infected, which just keeps the cycle going. Reducing coyote density around pastures can also be part of it in some areas.
Makes sense. What about managing the cattle herd itself?
Again, a closed herd policy helps. Testing any new animals before they join the herd, and then, yes, identifying those seropositive carrier cows. The strong recommendation is to cull them from the breeding herd. And, critically, do not keep their daughters as replacement heifers for breeding, because they are very likely to be congenitally infected carriers themselves.
So you really have to break that vertical transmission chain.
You have to. And, adding to the challenge, There's no commercial vaccine available for neosporosis.
No vaccine either, so it's all down to management and biosecurity.
Pretty much entirely focused on breaking transmission and managing the existing carriers out of the herd. It's a constant effort.
Okay. Now, you mentioned Neospora is related to toxoplasma, which people often worry about, especially regarding cats and pregnancy. So the obvious question, is Neospora a risk to humans?
That's a really common question, and the current understanding is quite interesting. Scientists have found antibodies against Neospora in human blood samples. Sometimes the rates are quite low, like 0% in some studies, but others have found up to nearly 38% of people tested showing antibodies.
So people have definitely been exposed to it.
Yes, there's evidence of exposure, but, and this is the crucial part, despite finding antibodies, there has been no definitive proof that Neospora actually causes clinical disease in humans.
Meaning no one's actually gotten sick from it, as far as we know.
Exactly. Studies have looked for the parasite's DNA in samples from humans with various illnesses, and they haven't found it. So while people can be exposed, the current thinking is that it's an unlikely opportunistic zoonotic agent.
Okay, so unlike lepto, which is a definite human health risk, Neospora seems much less likely to cause problems in people. That's an important distinction.
A very important distinction. It really highlights the difference between just being exposed to something and that thing actually making you clinically ill.
Right. Okay, let's try and tie this all together now. We've dug into two very different microscopic villains, a bacterium and a protozoan, but both causing similar devastating outcomes, mainly abortion. When you compare leptospirosis and neosporosis side by side, what are the main takeaways, the key similarities and differences?
Well, the big similarity, obviously, is the impact. Both cause significant reproductive losses, abortions, stillbirths, weak calves, and that leads to the other big similarity, major economic burdens for producers.
Yeah, those numbers were stark.
They really are. Both also present diagnostic hurdles, because they can be silent or subclinical, meaning you often need multiple tests to really pin them down. And for both, good biosecurity stopping the spread is absolutely fundamental to management.
Okay, those are the common threads. What about the crucial distinctions? Where do they really diverge?
Quite a few places, actually. First, the cause. Lepto is bacteria, a spirochete. Neo is a protozoan parasite. Big difference biologically. Then the hosts involved. For lepto, cattle themselves are major reservoirs, along with wildlife, pigs. For Neo, you've got that crucial dog-wild canid definitive host, with cattle just being the intermediate host. That changes control strategies massively.
Dog connection, yeah.
Transmission routes, too. Lepto is mainly a horizontal, spreading through urine, contaminated water, contact. Neo is primarily a vertical mother to calf, although that horizontal spread via dog feces causes the big outbreaks, the abortion storms.
And the tools we have.
Big difference there. We have effective vaccines widely used for lepto. We have no commercial vaccine for Neo.
Huge difference.
And treatment. Lepto can often be treated with antibiotics, especially if caught early. Neo, no effective treatment. Culling carriers becomes a key strategy.
Okay. Any other key differences, maybe in how they actually cause the abortion?
Yeah, the pathogenesis detail we touched on. Lepto infects the fetus, but often without triggering that classic inflammatory response in the uterus, which makes it stealthy. Neo involves the parasite actually multiplying in the fetus, causing direct damage, plus placental issues and the mother's immune reaction.
And finally, the human risk factor.
Massive difference. Lepto. Significant confirmed human health risk can be severe, even fatal. Neo, currently considered unlikely to cause clinical disease in humans, despite evidence of exposure.
That's a great summary of the contrast. So looking at the bigger picture for cattle farming, for sustainable production, it's clearly not enough to just focus on one disease at a time, is it? You have to see the whole system.
Absolutely not. It really underscores the need for a comprehensive, integrated herd health plan. It's got to go beyond just tackling specific bugs. You need to look at the fundamentals like proper nutrition, reducing stress.
Nutrition, how does that play into infectious diseases like these?
Well, it's foundational, isn't it? If we connect this to the bigger picture, you need good nutrition for a strong immune system, period. And a strong immune system is crucial for fighting off infections and for optimal reproductive performance.
Makes sense.
If animals are deficient in key nutrients, things like minerals, zinc, copper, manganese, or vitamins like A, D, E, B12, their ability to mount an effective immune response is significantly compromised. They're just more vulnerable.
So poor nutrition could make herds more susceptible to outbreaks or make the consequences worse if they do get infected.
Exactly. You can think of it as a hidden cost. The economic losses you see from lepto or neo-infections, they can be made much worse if there are underlying nutritional deficiencies weakening the animal's defenses.
So a truly holistic plan needs to include things like testing feed, making sure the diet is balanced, maybe targeted supplements.
Precisely. It's about optimizing immunity from the ground up, which helps protect against a whole range of health issues, including these devastating reproductive diseases.
We have certainly taken a deep dive today
Mm.
into this, well, fascinating but also quite alarming world of cattle reproductive health. From the stealthy nature of leptospirosis to the really persistent challenge of neosporosis, it's clear these are complex problems, all interconnected.
They really are. And effectively managing both lepto and neo, it's just paramount for keeping herds reproductively healthy and, frankly, keeping cattle operations economically viable. It really highlights how vital, evidence-based veterinary advice and just constant vigilance are.
It definitely does.
Mm.
And thinking about the future, this raises an important question, perhaps a provocative thought for you, our listener, to mull over. We hear a lot about genetic technologies like CRISPR-Cas9. If these tools offer the potential to actually engineer cattle that are inherently more resistant to pathogens like Leptosambra and Eospiro, how do we as a society balance that immense potential for improving animal health and reducing economic loss with the ethical questions, the practicalities of implementation, and wider public acceptance?
That's definitely something to think about.
Indeed. A thought to leave you with. Thank you so much for joining us on this deep dive. We hope we've shed some light on these complex issues. Remember to keep that curiosity burning.